Doctor, can we talk about cancer a little bit? Various types out there. What are some of the things that you've seen in terms of your patients, and what some of the things that you've been able to do?
A better thing to talk about in relationship to, well, I will talk about that, right? A better thing to talk about, however, is the relationship between profits and cancer in the United States. There was a study that was published, I believe it was in 1994. It was a 12-year program, 12-year study. They looked at adults who had developed cancer as an adult, not childhood cancer, but adult cancer, right? And this is the main types of cancer that we get here in the United States. They did a meta-analysis of these people all around the world who developed cancer as adults for 12 years and were treated with chemo. And they looked at the results. And they published the results in the Journal of Clinical Oncology. And the results? 97% of the time, chemotherapy does not work. 97% of the time, it doesn't work. So why is it still used? It's one reason and one reason only: money. If you go to a medical doctor, an MD, with a sinus infection, and that doctor prescribes an antibiotic, he gets no financial kickback. Now, if he prescribes 5,000, of that antibiotic in 1 month, the drug company that makes it might send him to Cancun for a conference, right? Mm-hmm. But he gets no direct remuneration. It's not with chemotherapeutic drugs. It's different. Chemotherapeutic drugs are the only classification of drugs that the prescribing doctor gets a direct cut of. So if your doctor prescribes chemotherapy for you, here's how it goes, more or less. The doctor buys it from the pharmaceutical company for $5,000, sells it to the patient for $12,000, insurance pays $9,000, and the doctor pockets the $4,000 difference. And there ought to be a law. The only reason chemotherapy is used is because doctors make money from it. Period. It doesn't work 97% of the time. If Ford Motor Company made an automobile that exploded 97% of the time, would they still be in business? No. This is the tip of the iceberg of the control that the pharmaceutical industry has on us. Most people have no idea of this at all. Now,
But, Mike, not only are we getting that scenario where, oncologists are prescribing chemotherapy for patients that may not even have cancer, and they're making money on it, right? I interviewed Dr. Sunil Pai, and he said he calls it a reimbursement, but it's really a kickback. Doctors, oncologists get kickbacks on chemo. That's unique among the drug world. That's, to my knowledge, the only class of drugs that they get kickbacks on is chemo.
Yes.
So
it's almost designed for corruption. It is a corrupt system. In almost any other industry, that activity would be illegal. Like in the Olympics, when the decision makers for the Olympics committee, if they accept bribes, which they've been caught doing, well, that's considered criminal. They might be arrested or kicked out of the committee. When doctors get kickbacks in the cancer industry, that's just considered business. The problem is it's business that is not in the interest of the consumer. And as we've seen, as in this case, consumers are being deliberately harmed and milked for money. Milked for insurance money, Medicaid money, Medicare money. You see, in many cases, the patients themselves aren't making the payments. The payments come from government. So it's a racket that involves at least 4 parties. The cancer doctor, the chemotherapy manufacturer, drug company, which lobbies the government, and the government makes the payments, and the patient, their body, is the vessel through which all of this nefarious activity takes place, all these violations. You got to have a patient's body in order for this racket to work, for everybody to make their money. Truth is, they don't need the patient's body. It'd be better if they left the patient out of it and just threw the chemotherapy in the trash and billed the government, and the government paid the drug company and left the patient alone. That would be better, believe it or not.